Welcome back to Breakfast Television. This is pretty incredible that 1 in every 3,000 babies is born without an ear. But surgeons here in Calgary are reconstructing these ears for children out of their own tissue. This is incredible. And our health specialist, Leah Sarich, is here with one boy's story.
Yeah, this is an incredible story. So really an example of the remarkable cutting-edge medicine that's happening right here in Calgary. So yes, 1 in 3,000 babies is born without an ear. 1 in 1,500 is born with a syndrome like Alessandro Manzoni, the little boy I met. Alessandro was born with a syndrome that affects 5 parts of his face, including his ear. So there you can see he's missing an ear there. And that is on his right side. Now, these pictures show what he looked like a couple of years ago. Before his reconstructive surgeon, Dr. Ryan Frank, and the team that he works with, they started working to build him an ear. There's Dr. Frank right there. So this is Alessandro now. He's 13. He's had a couple of surgeries now. But Alessandro, like many children born with a missing ear, usually born with most of the actual inner ear intact, but with no outer ear. So it's not a question of restoring his hearing per se. They can actually get a hearing aid that works with the other ear so that he can hear just fine. And he is hearing fine out of the other ear. This is about making it look more normal, making his ear look more normal. And of course, for children, that's really going to help with their self-esteem and their confidence. So definitely an aesthetic procedure, not a functional one. It is a process, though. It requires usually 3 surgeries over a year and a half. The first surgery is usually the biggest one, and it happens after age 6 when the good ear is 90% grown, and then it can act as a guide for the reconstructed ear. Dr. Frank explains how the building of an ear starts.
They come in for 6 or 8 hours in the operating room. That's where we're actually making the framework of the ear out of their rib cartilage. We tuck it under their skin. They stay in the hospital for 4 or 5 days. It takes about a month to recover from. And then basically we let them go on their way, and we don't plan to do another surgery for around a year later. The second surgery is done at a year, and that's where we actually take the framework of the ear that's been placed under their skin around where the ear belongs and lift it up off the skull to give it some projection.
Isn't that incredible? So you can see the 3 pieces there. So you've got the mold, then you've got the piece of cartilage they take from the rib there, and then he molds that and connects it with little tiny wires to create that new bit of the ear, which is then implanted under the skin, and it stays there for quite a while before they do another procedure, a second one, where they lift the ear up to give it some projection. So that second surgery takes about 4 hours. So the child's going to recover a bit more quickly from that one because the surgeons this time are not doing the rib removal. So they take about 2 to 3 weeks to recover there. So students use that rib cartilage because there's a better chance of the tissue surviving and getting a blood supply, and less of a chance that the body will reject it because it belongs to the body of that actual child. So it works much better than a plastic, certainly. Less chance of infection as well. However, with any surgery, there is always a risk, and the longer the surgery, the greater the risks. But if you ask Alessandro and his family about the risk-benefit ratio they always talk about in medicine, they think with his new ear, the benefits far outweigh the risks.
It's better than having like this side and then everybody's staring at me.
It makes a really big impact on his life, especially when we go on to public and people are staring at him. Now he has less attention on that way than before.
So that's huge. It makes a huge difference for Alessandro. He's such a cute guy. And you know, Alessandro's family is from the tiny island of Tonga in the South Pacific. His sister says, you know, they would have had nothing for Alessandro there, certainly. They immigrated to Canada back in 2003, and they're forever grateful for the health care they've received in this country. Alessandro still has a couple of more surgeries to go to get that ear just right, but so far, he says, and I quote, this is what he says to me, pretty cool and awesome. That's what he says about his new ear.
Wow, that's sweet. And, you know, quite the journey for...
It's a huge journey for him and the entire family. Yeah.
Good. Sure. More information on your blog, as always. Okay, breakfasttelevision.ca for that. Thank you, Leah.
You're welcome.
And on over to Andrew.